When we talk about AI in healthcare, I think we need to understand it as a foundational change in the toolkit we have available. In the same way, and I mean this profoundly, that algebra changed our understanding of the world and of math.
In our field, the major changes are happening in diagnostic testing. How we can now interpret them more effectively and without as much expertise needed. We are seeing the old patterns of care change into new ways of doing care.
The topic of how is AI going to be used is so interesting because these new machine learning, sophisticated models, they aren't the end of the question, it's the beginning of the question.
AI is the future of healthcare, or so we've been told. But what does it mean? Is it coming for your job? Is it saving your life? What risks does it pose? And how does it have the potential to affect you?
Artificial intelligence has in some form been around for decades, but most people are just finding out about it because of things like ChatGPT, which have come into the mainstream. In healthcare, artificial intelligence has been around for years as well. It's helped doctors transcribe notes faster. It's helped with patient experiences with chatbots. But with generative AI, it's really supercharging what healthcare professionals and scientists are able to do by helping predict future health risks, make diagnoses faster and more accurately, and also helping with potential drug discovery for new novel treatments and therapeutics.
The AI boom really hit healthcare in the last 5 years. We've actually been able to transition into having the models or the tools we built to actually work with the data very effectively and have been able to define new ways to treat diseases, new ways to diagnose diseases, and finally find individualized signatures of how I as a patient or somebody else as a patient would do if they got a certain treatment or therapy.
The Gen AI boom is assisting doctors in more advanced ways, but both clinicians and patients are questioning the risks these new technologies may bring with them.
I think a lot of people are wondering, what's this going to look like when I go to the hospital, when I go to the doctor? How's it going to be used to inform decisions? What about errors, false positive, false negatives? Who's going to be responsible? There's a lot of questions around this that really begs the expertise of people in different areas.
So we have agencies like the U.S. Food and Drug Administration that does oversee certain uses of AI in healthcare. There are also groups like the American Medical Association and the National Academy of Medicine that do put out guidelines and codes of conduct for responsible use of AI. So right now there are experts and there are various groups that are trying to oversee this and make sure that it's used responsibly.
So there is this big tension about how AI will affect our workflows. Clinicians have the ability to interact with patients, understand their preferences. So I still feel they'll have a key role to play in interpreting the outputs that the AI technology gives them.
While the larger AI labs from Google to OpenAI are trying to disrupt the healthcare industry at large, there are smaller and more focused labs within academia dedicated to applying AI to specialities.
Well, we assessed how well the model performed looking at different views.
We're seeing an increasing investment in AI in healthcare. Since 2020, there has been a substantial increase in venture capital funding coming into this space. In 2024, we saw around $11 billion in funding going to various different AI and healthcare startups. Experts say that academics have different priorities than some of these AI startups. Academics can fine-tune large language models, and they may have a different incentive to develop ethics guidelines around their responsible use.
I think our biggest risk with AI is making sure we use it responsibly and consistently. We want people to pursue this creativity to the ends of the earth, but we also need clear processes in place to ensure that before they ever make it in front of a patient, they have been through a series of stage gates and reviews to ensure they are safe, effective, fair, and equitable.
Yale has invested $150 million towards AI development over the next 5 years. One of the ongoing efforts at Yale Medicine is the Cardiovascular Data Science Lab, founded by Dr. Rohan Khera in 2020.
So this is the Cardiovascular Data Science Lab, or the CARDS Lab. It's not a single domain of AI that we work on. We work on diagnostics, on precision care, or defining therapies that work for individuals, work for cardiac imaging, and other ways that we use to enable better care for patients. A good example is electrocardiograms, which are electrical recordings of the heart taken with stickers on the chest, available world over. The ECG GPT, which is a play on ChatGPT, it takes an ECG image and generates a report. That is an example of generative AI. We can generate a full report directly from the electrocardiogram. Originally, this would require a cardiologist to interpret these studies, but our hope is that this can form the basis of very accurate reads that are available world over that eventually clinicians can confirm and use in their care. So we decided to focus on app-based solutions rather than things that integrate in large health systems so that these tools are truly accessible.
Here we have a typical 12-lead ECG. And we know, me as a human reader, I can see these are the leads coming in from the chest. But for me, looking at this, I could never tell you this is a patient with heart failure just based on their ECG. What the AI eyeball is able to do is to kind of isolate these two leads and detect some signal that triggers that, yep, this is someone with left ventricular systolic dysfunction and ejection fraction of less than 40%. And it visualizes it in a way that a human reader wouldn't be able to detect.
While facilities like the Cards Lab are developing these new AI tools at a rapid pace, there are still many steps needed before these technologies can be implemented. To ensure the public well-being, regulators may wish to impose oversight and guardrails before AI becomes the new standard practice of care.
In terms of AI and misdiagnosis, experts say that the cases of and examples of this are pretty limited at this point, because even though an AI might make a mistake or might make a misdiagnosis, there is still a real doctor involved in the diagnosis or prescription of a medication.
So are we really going to become healthier? I think it's not just the $1 million question, it's the $1 million life question. There is benefit to technology, there is benefit to AI systems, but it really requires that all of us, we need to be able to access, we need to be able to use this, we need to be willing to use it, and we need to have that space or energy to do it.
You know, on the wall of my office, I have 4 photographs. It's the transistor, the camera, the telephone, and the source code for the World Wide Web. Because to me, those are the enabling innovations in my lifetime that transform the way we deliver care. Telemedicine, electronic health records, MRI imaging, all of that derives from those foundational innovations. I think AI is in that category.